But now I'd like to turn to our final speaker, who is Dr. Cheryl Pegus, who will discuss the potential for employers who really have access not only to employees, but to families and communities. I want her to discuss the potential for employers to promote whole person population health from her perspective as the Chief Medical Officer at Walmart.
Thank you very much, Margaret. Great to be with everyone in this wonderful panel. We'll go straight into my first slide, which really talks about how do you provide care even during COVID-19. And I think many of you are aware we are the largest employer. We have 1.5 million associates. And during COVID-19, we were open because we have frontline associates. And so that care that you do as an employer really matters. It's not just the connections that happen when you seek out care through a clinician. It's ensuring that you educate your employees. It's ensuring that you answer every question. There are no stupid questions. They're all really important. And by the way, in a pandemic that we were all learning about, it's putting in, Dexter and David talked about this a little bit, but processes, be it Six Sigma or others, daily screening, free PPEs. Everyone remembers sneeze guards, social distancing, changing everything you've always done and attempting to do it in a couple of weeks to make sure that you're not only there to serve the community, but you're able to be as safe as you can for your own associates. And then ensuring that there were time off so that if people got sick, they had the requisite time and that you were able to continue to be open for the country. So a lot happened during COVID-19. And I think a lot of employers recognized their role in healthcare for their own employees and what they themselves had to do. We've gone on to do a lot of that just around COVID-19 immunizations. And I think everyone's aware of what we've been doing around the country, but just think for our own associates and ensuring that what we've done is we've had closed pods everywhere from distribution centers to places in Alabama, New Jersey, where you could take the time and come and have your immunization. We actually offer you time off. We offer you an incentive to receive your immunizations and doing that again across our footprint. We at Walmart have over 5,100 sites and 90% of America lives within 10 minutes of our sites. Most of our associates come from the communities that we serve. And so really one way that we see ourselves playing a role is what we do for our associates really matters because their needs are the needs of the community. Outside of COVID, for our associates, we've done a lot of different programs. It's been a stressful year. Mental health, I know I've talked personally about just how stressful this year has been and all that's been required of us, and really connecting to our associates that we know how you feel, and here is how we're caring for ourselves. I've talked about sleep a lot in the last year, more than I did during my cardiology fellowship, it turns out, because sleep really matters, as Dexter just shared, in really being able to care for yourself and others. So that ability to be very connected, that we are all going through this together, and here are all the services that we at Walmart have for you, and here are the ones that I personally am using, have really mattered for our associates, and they feel as if they know that their questions are our questions and the solutions forward include them. We've continued our work, as I've shared. We've got associates over our 5,100 footprint. 4,000 of our stores are in HRSA designated medically underserved areas. In some communities, Walmart is the site that people go to receive any healthcare information before they move on to other areas. And if everyone recalls, in January, we were immunizing just 65 plus. And then we've continued to broaden eligibility to where we are today. And our strategy has been to be out front with whatever segment of the population needed their immunization. So when it was 65 plus, Medicare, Medicare Advantage, we partnered with every payer in the country to ensure that they were able to call their own members. They were able to assist with transportation, and we were there to provide immunizations either at our store or at sites. We went into communities. We've done over 400 community events in underserved communities, be it Tennessee, Chicago. We've done lots of events with teachers as they've become eligible, but that recognition that people may not come to you, you've got to go to them in their community, partner with community leaders, and provide solutions for them. Again, what we've been talking about here with health, how do you ensure that there's trust? How do you ensure that there's access for whole person health? It has to be in the community and it has to be local. And so we've done that with many partners. We now have a campaign called GOTV, which we've taken from Get Out the Vote to Get Out the Vaccine. This weekend, we're at NASCAR events, again, reaching communities where there may be vaccine hesitancy. And we've been doing this across the country since we started in January. But what does that mean? So you've heard me talk about our locations and what we provide. And I think the real point for us is that healthcare occurs outside of a clinician's office. We've talked a little bit about the needs in communities, be it of food, be it of just a healthy environment, knowing what occurs in someone's home. And we've done a lot in just demonstrating our abilities to partner in communities to ensure that we can provide solutions. We have what we call our health equity commitment, where we're making equity a strategic priority, building the infrastructure to support health equity, addressing social determinants. Our first ones that we're looking at are food insecurity, maternal and infant health, and we're also looking at cardiometabolic diseases. And as you can see, the demographics for these are not just race and ethnicity. We know they affect people geographically, and they also affect different communities differently. The partnerships are critical. You've heard me talk about that. We see our role as partnering for success and measuring what we do as we go ahead on the pursuit of this work. This is really, I think, speaks to a lot of what we all think about whole health. For 100% of our health, about 40% of it is around social determinants. About 30% is health behaviors. Dexter stressed some of those. How do you help someone, but even if they have a chronic disease, know how to manage their hypertension when they're not with a physician, manage their diabetes or their asthma? This 70% of health, we believe that we can help all organizations partner, but we believe for those that we serve, particularly in these medically underserved areas where they see us as a point of care, we can provide many of those solutions. We have pharmacies, optical centers, dentals, Walmart health clinics. We provide audiology services. We provide food care and recently acquired telehealth. And so if you go to my last slide, our goal really is to look at how do you bring care to people in an omni-channel manner? Where do you address the key components of whole health, social determinants, personal behaviors, clinical care, and how you influence environments to be able to provide the right care and solutions that they need. We're excited about the partnerships that we will do for success, and we're excited to also measure what we will be doing. With that, I will turn it back to you, Margaret.
Thank you so much, Cheryl. That was stunning, absolutely stunning. Both what you're doing within Walmart and what you're doing for the communities and how you can reach across the country. Wonderful.